Hello and welcome. In this video, we will briefly cover some aspects of history taking, evaluation of patient in a situation where a woman is asking for some kind of therapy due to menopausal symptoms. We will also briefly discuss the NICE guidelines for menopause. So hormone therapy involves the administration of synthetic hormones and to replace a woman's depleting hormone levels and thus alleviate menopausal symptoms. However, this therapy has been linked to various risks. Debate regarding the risk and benefit ratio still continues. How do patients present? The spectrum and intensity of perimenopausal and menopausal symptoms will vary greatly, depending on the effect of the decreasing circulating levels of estrogen on various organ systems. The most common presentation of menopause, that is in 60% of patients, is hypothalamically mediated vasomotor instability leading to hot flashes, sweating, and palpitations. Other common presenting symptoms will include irregularity of menstrual cycles, urogenital symptoms such as vaginal dryness, soreness, superficial dyspareunia, urinary frequency, and urgency. And certain psychological symptoms such as mood changes, insomnia, depression, and anxiety. The physiological effects of menopause are due to the decreasing hormonal levels, and these cause some vasomotor instability leading to symptoms, urogenital system atrophy and thinning of the mucosal lining of the urethra, urinary bladder, vagina, vulva, loss of vaginal elasticity and distensibility, reduced vaginal secretions, degeneration of subepithelial vasculature, and the supporting subcutaneous connective tissue. Bone metabolism is also affected, causing progressive bone loss. And cardiac function is also altered, as a result of which women are more susceptible to heart disease. If we overlook at the brief history of hormonal therapy and other kinds of therapy in women, we see that over the years, hormonal therapy had become a very popular treatment, as it was recommended not only for treating menopausal symptoms, but also for providing long-term protection against osteoporosis and related fractures, heart disease, and Alzheimer's disease. However, in the year 2002, the Women's Health Initiative study, which was a large-scale study conducted by the National Institute of Health in the United States, was stopped early because evidence linking hormonal therapy to a slightly increased risk of stroke, heart disease, and breast cancer. As a result of this findings, many women turned to non-US Food and Drug Administration approved compounded bioidentical or natural hormone therapies as a perceived safer alternative. However, to date, there is no clear evidence that any of these products are safer or more effective than the FDA-approved hormonal therapy products. Physicians may wish to use custom formulas for those patients who cannot tolerate standard hormonal therapy. So, how do we evaluate a patient who is asking for hormonal therapy? Patients must be thoroughly evaluated by taking a detailed history and complete physical examination. The objectives are making a proper diagnosis and identifying any contraindications. It's important to know what kind of symptoms the patient has. It's important to know what background she comes from and what are the expectations that she has of herself at this age group and the family has for her gynecological history, her sexual history, previous medical history, surgical interventions, any psychiatric problems, if she has ever had fractures in the past, does she have any difficulty with cognition or memory loss? In addition to the history, the patient should also have a physical examination to include height, weight, determination of the obesity index or the BMI, blood pressure measurement, breast examination, abdominal examination, and a pelvic examination. Evaluation of hormonal therapy should also be done through some lab investigations and some imaging. And the lab investigations will include some baseline studies to see the general health of the patient. So do a complete blood picture, urinalysis, fasting lipid profile, blood sugar levels. In women who have premature menopause, we can even do serum estradiol levels, follicle stimulating hormone levels to confirm that they are indeed going through a premature menopause. A pelvic ultrasound is important to measure the endometrial thickness and the ovarian volume, and an ECG to assess the cardiac status, a pap smear as a screening test for cervical cancer, and a mammography performed once every 2 to 3 years and annually after the age of 50 years. So endometrial sampling is not always required in routine practice. However, the presence of abnormal bleeding before or during hormonal therapy should prompt consideration of ultrasound to check endometrial thickness, followed by outpatient PIPEL sampling and hysteroscopy. If the woman has a tight cervix, then formal hysteroscopy and dilatation and curettage under general anesthesia are advised. So as far as non-hormonal therapies are concerned, they can be effectively used in symptomatic menopausal women. Among these, after 6 months of treatment, pollen extracts might achieve a better improvement of hot flushes, sleep disturbances, and menopause-related symptoms than soy isoflavones. Herbal remedy from pollen extract is mainly effective when the quality of sleep is the most disturbing complaint. Other non-hormonal therapies include a change of lifestyle so that there is more physical activity in the form of walking or some other kind of exercise, dietary supplementation. Patients can go for herbal remedies to ease themselves and to ease their symptoms. Some people find acupuncture very helpful, vaginal moisturizers and lubricants. Selective serotonin uptake inhibitors and serotonin norepinephrine reuptake inhibitors. These kind of treatments will be very beneficial as an antidepressant and can help hot flushes in some women. Gabapentin and pregabalin. These medications are sometimes prescribed to reduce hot flushes. Cognitive behavioral therapy may be helpful for managing mood swings, anxiety, and sleep disturbances associated with menopause. This is a time of a woman's life when many changes will be taking place in her life. Her children may be moving out, getting married. The husband may be facing illness, or there may be a separation. And so women often go through difficult time at this perimenopausal and menopausal stage. Bioidentical hormone therapy involves hormones. It is sometimes considered a non-hormonal alternative to traditional hormone replacement therapy because it uses hormones structurally identical to those produced by the body. Some cooling techniques, for example, dressing in layers using fans and keeping the bedroom cool, can help manage hot flushes. It is essential for women experiencing menopausal symptoms to discuss their options with a healthcare provider. The choice of non-hormonal therapy should be based on individual symptoms, medical history, and preferences. Now we will just talk very briefly about the guidelines for menopause as prescribed by the National Institute of Health and Care Excellence in the year 2015. Please note that since the 2015, no dramatic changes have taken place in the way that we use the hormonal drugs or even the non-hormonal medications and strategies. So the NICE issued guidelines on menopause that recommend that doctors should offer women HRT for hot flushes and night sweats after discussing the risks and the benefits. Consider HRT to ease low mood that occurs because of menopause, and consider cognitive behavioral therapy to alleviate low mood or anxiety. Explain that estrogen alone, HRT, has little or no increase in the risk of breast cancer, while HRT with estrogen and progestogen can be associated with an increase in the risk of breast cancer. But any increased risk reduces after stopping HRT. Specifically, it says that there will be 17 more cases of breast cancer per 1,000 menopausal women in current HRT users over 7.5 years compared to no HRT. The other guidelines state that HRT does not increase cardiovascular risk when started in women aged under 60 years, and it does not affect the risk of dying from cardiovascular disease. Also ensure that women with cardiovascular disease are not automatically excluded from taking hormone replacement therapy. Refer women to menopause specialist clinics if there is no improvement after the trying treatment. Hormone therapy continues to be the most effective treatment for menopause symptoms such as vasomotor symptoms and urogenital atrophy, according to the International Menopause Society. Other guidelines say that menopausal hormone therapy, including tibolone and the combination of conjugated equine estrogens and basidoxifene, is the most effective treatment for vasomotor symptoms associated with menopause. If menopausal hormone therapy is contraindicated or not desired, selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors such as paroxetine may well be considered, including gabapentin. Menopausal hormone therapy can be initiated in postmenopausal women at risk of fracture or osteoporosis before 60 years of age or within 10 years after menopause. With this, we come to the end of the video. If you like this video, then please press the subscribe button. Press also the like button, share with friends and colleagues, send your comments, and press the bell icon if you want notification of future videos. Thank you and goodbye.